Paddle, paddle, paddle. What happened to those paddle arms? And 1, 2, 3, face in. Very nice, Dave.
It amazes me just how much we learn as children that we use for our entire life. If we're lucky, our parents taught us how to eat right and exercise. But no matter how much we learn in school about our bodies, it seems that many of us never achieve enough of an understanding to avoid common overuse and misuse injuries to our lower extremities. I'm saying this because no matter how painful a foot condition is, 99% of the time, that pain could have been completely avoided with just a little instruction. In 1989, I had the unique privilege of training under Dr. Stephen Smith, the only podiatrist ever to be acknowledged and published in the New England Journal of Medicine for his work on developing procedures to treat flat-foot deformity. Through his work, Dr. Smith developed one of the finest heel pain treatment protocols in the world. I was lucky enough to be his last intern, and the fundamentals of what he taught me have been refined and proven to be what I believe the most effective way to treat common heel pain symptoms. Our goal is to get you to 100% improvement over the shortest period of time, and to give you the tools that you need to keep that improvement and minimize the chances of relapse. Of course, your compliance will ultimately be the deciding factor in whether or not you improve your condition. So listen carefully, because there is information that you must understand and use if you're going to succeed in ridding your body of this pain. Now you may want to jot notes, but please don't. Simply go to our website and review at home. Here's a fact. The Feet for Life website is the best place to get tons of great information. It is linked to many top sites in the world because of its easy to understand and diverse content. By now you're asking why. The why question can be answered in many ways. Why do you have foot pain? Poor footwear, trauma, overuse, pregnancy, changes from a high to a low-heeled shoe, or wrong exercise without stretching are many reasons. Let's take a look at common presentations. Actually, this is very cool because you're about to see firsthand just how and why heel spurs form. It all starts with a tight ligament called the plantar fascia, and a tight tendon that we call the Achilles tendon. Now the plantar fascia is a ligament that runs from the bottom of your heel into the ball of your foot. Now because the plantar fascia is a ligament, its ability to stretch is very limited. So when excessive tension is placed on this ligament, it pulls tightly at its insertion into the heel, creating tiny cracks which form bone spurs. Heel pain is a result of excessive pulling of the plantar ligament and the inflammation that is caused by that pulling. Now's usually the time that a patient will ask, well, is it the spur that is causing my pain? Well, the answer is that most of the time, even if you have a very large heel spur that has been growing for years, the plantar fascia being inflamed is the cause of your pain, and the heel spur, which may have grown over a period of many months to years, is simply due to the tightness of the fascia. This means that many people can grow fully developed heel spurs and never have any heel pain. The reason for this is that the spurs grew slowly over a long period of time. So many people with large, fully grown heel spurs may report that they remember sometime having some pain in their heels, but never enough to bring them to the doctor. So therefore, we know that in most cases the spur is not the cause of the pain, and therefore does not have to be removed. So now hopefully we have alleviated your anxiety about your heel spurs. Let's now get down to the business of getting rid of your pain. This is important. The key to getting rid of your heel pain permanently lies in stretching the Achilles tendon, by stretching the calf muscle and in some cases supporting the arch. When I read your x-ray, I'll pay close attention to the bottom of the heel the height of the arch, and the back of the heel. If I detect that there is spur formation on the bottom or back of the heel, it tells me that there is excessive tightness of either the plantar fascia on the bottom of the foot or the Achilles tendon on the back of the foot. Often these are both related. You see, a tight Achilles tendon causes flattening of the arch and tightening of the plantar fascia. Your Achilles tendon can become tight for all the reasons previously mentioned, including overuse during exercise and lack of stretching. So if you are a woman that has been used to a higher-heeled shoe and has recently gone to a flat shoe, your Achilles tendon is often shorter and tighter. A tight Achilles tendon will pull up on the heel bone and cause a tightening of the plantar fascia and a lowering of the arch. With this animation, you can see the process. So when you come to the office on your first visit, you're told to stay out of flat shoes. And this often means no boat shoes, deck shoes, moccasins, thongs, slippers, sandals, loafers, or barefoot walking. For women, we also include no flat dress shoes. What we recommend that you wear is a good walking shoe or running shoe. Flat shoes like Keds tennis shoes are not recommended. Next, we will dispense a 1/4-inch rubber heel lift that you will put into your shoes. This heel lift will elevate your heel height and reduce the tension on both the Achilles tendon and plantar fascia. We will also dispense a rubber strap, which is utilized to provide compression on the inflamed areas around the heel. The cornerstone of the treatment is the ProStretch. This is a device that should be used at least twice a day. The device is designed to provide a maximum stretch of the Achilles tendon. The device should be positioned next to a table or wall so that you have something to hold on to for balance. Your foot should be placed into the device only when wearing a shoe. Do not use this device barefooted. Next, you should straighten your leg and fall back on the device, allowing your Achilles tendon to stretch. You'll feel a deep stretch into the calf muscle, and this is normal. With your front foot, you can push up on the device to further stretch your tendon. The stretch is not a rocking motion, but rather a position that is held initially for 30 seconds at a time, working your way up to 2 to 3 minutes per stretch. Optimally, 3 sets should be performed for each workout. The ProStretch provides an active stretch of the Achilles tendon and calf muscles. On occasion, it is necessary to dispense a night splint. Night splints are devices that provide a passive stretch of the Achilles tendon and is used at night while sleeping. A night splint is usually not dispensed on the first visit. Arch supports are often necessary to provide additional support of the arch and plantar fascia, especially in patients with flat feet. Oftentimes, the arch support is combined with the heel lift and home shoe program to assure the success of your treatment. While undergoing your treatment for plantar fasciitis, it is important that you understand that activities that further contract the Achilles tendon can cause harm and hinder your progress. Therefore, it is strongly recommended that you refrain from running on pavement or the treadmill. If you are not used to a walking program, excessive walking should not be done. You may, however, use an elliptical treadmill. Stationary bike is also highly recommended, and swimming. During your office visit, you're most likely to be treated with some sort of anti-inflammatory therapy. This therapy is designed to relieve your pain and help me better understand the type of inflammation that you are having. There will come a time when you are discharged. My goal is to make that happen soon. Oftentimes, patients are instructed to continue a home shoe program and therapy after discharge. If you're watching this video and are curious about how you could prevent reoccurring episodes, the most important advice that I can give you is to avoid overuse and poor footwear, and to take over-the-counter anti-inflammatories like Motrin, Advil, and Aleve before engaging in any anticipated strenuous activity. These medicines will work much more effectively if they are introduced to your system prior to the activity that may be strenuous. Don't wait until after you have your pain to take the medication. Start taking the medicines 1 or 2 days prior to any strenuous exercise, anticipated vacation, or lengthy time periods on your feet. You now have important knowledge that you'll need to handle the very common foot problem called plantar fasciitis. There's no doubt in my mind that you'll have additional questions, which we'll of course try to answer. Please feel free to use our website, which has the most comprehensive data for heel pain sufferers.